Hi guys, and this is the first group medical group in third course of pedagogy Salahuddin University. As you can see, today we are going to talk about breast cancer metastases, and also here you can see our title presentation. Thanks.
Metastasis occurs when cancer cells break off from the original tumor, which is also called the primary tumors, travel through the body and begin to grow in other tissue and organs. Metastasis causes death by damaging important organs such as the brain, lungs, and the liver. Cancer cells continually break off from the primary tumors. Some of these cells may move into nearby blood vessels and lymph vessels. Cancer cells can travel along this vessel highway to other parts of the body. Many cancer cells die while traveling through the blood and lymph vessels, but some may survive and stick to the vessel wall, then move through the vessel wall into another body tissue. Where are cancer cells most likely to spread? Cancer cells tend to spread to the certain places in the body depending on the site where the tumor first formed. For example, breast cancer tends to spread to the bone, lungs, liver, and brain, and colon cancer tends to spread to the lung and liver. In this example, colon cancer cells have traveled through the blood vessels and form metastasis tumor in the liver. These metastatic tumor are colon cancer.
Today we talk about the breast cancer and its metastasis. Breast cancer is originated from the epithelial tissue, 85%, and 50% is originated from the mammary tissue. So, if the breast cancer crosses from the regional cancer to the another area, is metastasis, and metastasis kill the women. It's a matter of time. So, especially when it crosses the cancer, the axillary lymph node. Now, the survival diagnosis of past year only 7.8 million women diagnosed with breast cancer, and 685,000 women go to die. The survival rate with breast cancer is different from the country to country. Some high income country like USA and Europe, the survival rate is more than 90%, and in India is about around 66%, and the South Africa is only 44%. So it depends on income, and the treatment of the breast cancer depends on the stage of the diagnosis. So now the from 1930 to 1970, there are same degree of the breast cancer. There are no variability to healing state, but in 1980 it started to decline of death which caused by the breast cancer.
So I'm going to talk about the breast cancer in men. As you know, the men and women are different. Their breasts are different. So the breast cancer in men tends to be different from women. It's rare than women. So 1 in 100 of breast cancers tend to be in men, but it's quite a large number for a population like United States. So breast cancer in men tends to be different from women as it affects mainly the ducts. So it's called ductal adenocarcinoma, and it usually presents with irritation of the nipple and with the invagination and pulling inwards of the nipple. Breast cancer in men tends to involve men who are smokers, who use a lot of alcohol, who are obese, and it advances with age. So the older you get, the more chance you get breast cancer. It has also genetic background, things like Klinefelter's men, they tend to have more breast cancer. So this is a syndrome that some men born with. And also, once it comes to metastasis and the spread of cancer, the men tend to spread and metastasize their cancer into the bone rather than any other organs. And it also, the second most common organ that's been affected in men is the lungs. So the prognosis of breast metastasis in men and women are quite similar, but men tends to have more aggressive course of metastasis when it involves the lungs and the.
Hi students, our next lecture will be about the signs and symptoms of metastatic breast cancer. We have general symptoms and specific symptoms. General symptoms may include tiredness and loss of appetite, which lead to the body weight reduction. Specific symptoms of metastatic breast cancer depend on the site where the cancer cells are spread into. The most organ that the cancer cells spread into are lymph nodes, bone, liver, lung, and brain. If the site of spreading is lymph node, then the signs will be swelling under the arm or inside the breast. And if the breast cancer goes to the bones, then the patient feels back pain and broken of bones. And if the cancer cells spread into the liver, then the signs will be abdominal pain, swelling of the abdomen, and the loss of skin, which is called jaundice. And if the cancer cells spread into the lung, and then the signs will be shortness of breath, difficulty of breath, cough, dry cough, wet cough, with or without blood. And the other organ where the breast cancer spread into is a brain, then the signs symptoms will be headache, weakness of the patient, vision problem, loss of vision, and change in personality or behavior, confusion. For more information about the signs symptoms, you can go to the metastasisbreastcancer.com. See you soon.
Regarding the treatment, the use of following techniques is the way to stop metastasis or reduce it. First, standard chemotherapy, and second, targeted therapy. Regarding standard chemotherapy, it uses the cytotoxic drugs, which is a group of medicines that contain chemicals which are toxic to cells, and this causing reducing for the development of the disease. And second type is the targeted therapies, include hormonal, immunological, and anti-angiogenic therapy. For hormonal therapy, it either blocks or reduces estrogen. The second type, immunological therapy, employs antibody mechanism to block the progression. And the last is the anti-angiogenic therapy, which inhibits the new blood vessel growth and thus managing the disease. These drugs poses significant risks to the patient, may cause high blood pressure, bleeding, and hemorrhage, as well as heart failure. But there are still improvements in these drugs. Most of them are in use and giving better results. Combination of these therapies is already in use and giving better results.
Hello everybody, so now we are going to talk about the pathophysiology. This includes two subtopics. The first one is metastasis in general, and the second one is the most affected organs with metastatic breast carcinoma. So metastasis in general involve four major steps. The first one is the formation of a primary tumor. The second one is local invasion and neovascularization. The third step is intravasation. After that, cells should survive the circulation before it can arrest at a distant organ site. Then the next step will be extravasation and penetration in the foreign microenvironment, surviving into it, forming a micrometastasis. At this point, if it can survive into a metastatic colonization, we can see a clinically detectable macroscopic metastasis. So if we want to talk about the common affected organs, these include the bone, the liver, the brain, the lung, and the distant lymph node. This will depend on the associated subtype of these cells. You know, cancer is not a single type of cells. It could be luminal cells, it could be estrogen positive, it could be basal-like cells. This is related to the subtype of the cells. What about the host organ? It depends on the molecular feature like the availability of growth factors, the transmitters like the interleukins, the chemokines, and the essential receptors in order to allow the proliferation and invading of that organ. Thank you.